anyhow, just so I could get the bureaucrat mug.
And did you get it?
I did. It's great.
Yeah, that's great. Yeah, bureaucrat he's a character.
Oh my gosh, I had no idea that bureaucrat was your cat. That's so cool.
And that he's real. Yeah. We definitely get a lot of questions asking if bureaucrat is actually real, if he lives in Tigard. Like, I don't know who thinks we pull pictures off of Google or something.
Like a stunt cat.
All right, good evening, everybody. It is 5 p.m., so we're gonna get started. Just quick reminders that we record these meetings and live stream them on YouTube. Chat is turned off due to Oregon Public Meetings Law. Please raise your hands before you speak so that we can limit crosstalk. I'll turn it over to our new chair, John Trim.
Well, good evening, everyone. Hopefully everyone had a good weekend. It's good to see all the faces on Zoom today. I first want to just acknowledge in terms of, it's been almost a year since the death of George Floyd. Tomorrow will be the day that he was brutally killed by a police officer. And hopefully everyone take a minute to think about in terms of the process and the situation, the racism that was involved. And really in terms of why we're here. And I'm so grateful for the city to recognize that in creating this Public Safety Advisory Board so that we could look at some of the policy and the practices that the city is doing, that the police department is doing, and so that we could start to really dismantle racism from a cultural perspective, from an institutional perspective. So I want to welcome everyone. I want to really thank all the members of the board for your commitment to this work, because this is important work and it's a hard work. So thank you. All right, I want to go ahead and call the meeting to order. And with that, I want to go ahead and start with a centering exercise. But before that, I'm going to ask Kim if you could help us with a roll call.
Yes.
Thank you.
Commander McDonald.
I am here, and Nick Nunn, Officer Nunn, is unavailable. He's on a different assignment this evening, so he'll be missing.
Thank you. Shelby Rahala.
Here.
Michael O'Brien.
Here.
Abdi Rahim Mohammed.
Here.
Emilio Calderon.
Here.
Liz Newton.
Here.
John Trin.
Present.
Jimmy Brown.
Here.
Lee Landers. See Lee. Patty Lofgren.
Here.
Justin Lowe.
Here.
Danny Rauda.
Here.
Valerie Sasaki.
Here.
Sean will not be joining us this evening, and Jeff Mott.
Here. You hear me? Sorry.
You're good. John, that's a roll call.
Thank you very much. All right, now I'd like to invite you to join me in centering our conversation tonight. First, I'd like to read a statement, and then I ask you to join me in a breathing exercise to help bring focus and thoughtfulness to the conversation of today. Today, we are convened to listen and to learn from each other through reflection and discussion as we reevaluate and improve our public safety practices. We elevate the voices and experience of the community who have been and continue to be disproportionately impacted by inequitable systems. We thank you those who have advocated and worked to dismantle injustice in Tigard and a broader community. We build off their efforts to create more equitable and just outcome for people of all backgrounds and abilities. For the purpose of our meeting, we are looking into developing our understanding of current public safety structure, practices, and procedures. Identify and eliminate institutional racism within Tigard's public institution by centering equity and racial justice. Bring forth the concerns and experiences of ourselves and our community. Bring recommendation to the city leadership to improve the lived experience of all people in Tigard. Now we will do a breathing exercise, and you may turn off your camera for this portion. Close your eyes and gaze softly downward. Feel the chair underneath your legs. Breathe in deeply through your nose and out of your mouth. Feel your hand in your lap. Breathe in deeply through your nose and out of your mouth. Feel your feet on the ground. Breathe in deeply through your nose and your mouth. Slowly open your eyes and begin to breathe normally. Thank you all for participating in creating space with me. All right. Kim, was there any public comment?
There was. First, we have a guest with us this evening that Michael O'Brien is going to introduce.
Great. Michael, can you introduce our guest?
I'd be very happy to. Thank you for the opportunity to introduce Judge Emily Oberdorfer, who was named by the City Council as presiding judge in March after I semi-retired in January. Emily is no stranger to our court. She's appeared as an attorney a number of times, and she has served as a pro tem judge for several years now. So I will continue to work with the board, but I know that Emily will have an ongoing interest in the work of the board, and I'd give her an opportunity to introduce herself as well, with the permission of the chair, of course.
Please, Judge, if you could, please introduce yourself.
Hi, good afternoon, good evening, everybody. My name is Emily Oberdorfer. My pronouns are she, her. It's a real pleasure to be here today. I'm really enjoying my time at Tigard. And I especially want to thank you all for the hard work you're doing here specifically. And I will be here often or as little as you would like me to be.
Well, thank you for taking the time to speak with the Public Safety Advisory Board. Your comments are vital to the board missions. Each speaker is limited to 3 minutes, and so thank you for keeping within those time frame. And all comments need to be included your full name and address for the records. Written comments submitted by 10 a.m. today will be forwarded to the board members, and comment received after 10 will be sent to the board member after the next meeting. So the board would not be responding to the comments during the meeting. So I believe there was one written comment that was sent out.
There was one comment, and we had discussed several meetings ago that when we have comments that might require a board response, one or more members volunteering to take on that response. So we had a comment from Mr. Michael Antonelli, and he did have a request of the board to list 3 successes of the board, trying to be specific. Is there anyone who would like to volunteer to draft that response? Jimmy, is that you? Anyone want to take that on with Jimmy?
I'd be happy to draft a response and then provide it to the rest of the group via. I'll send it in to you, Kim, and Eduardo, and then perhaps you then can send it out to the rest of the group.
Yeah, that
is it. Okay, is there a time period for response? Do we have to do it within a certain period of time by public records law or anything like that?
I don't believe so, unless no, Shelby's shaking her head. So no, I think as long as we can maybe get something out by the next PISA meeting might be ideal. Oh, and Michael?
I'd be happy to work with Jimmy on that.
Great. So I
Thank you,
will
Michael.
trust the two of you to get together offline to work on that response. Thank you for volunteering, both of you.
Yes, thank you, Jamie. Thank you, Michael.
And then John, that is it for public comment.
All right. So if you have public comment for the board, written testimony must be submitted by 4:30 p.m. on the day of the scheduled meeting. And if you'd like to speak at our meeting, please email our staff, eduardo@tigard-or.gov. So that Eduardo is EDUARDOR at tigard-or.gov. All right. I don't see the chief on here, and I believe Commander McDonald will be giving us an update. So may I ask Commander McDonald to give us an update?
Sure. Thanks, John. Yeah, really the only thing the chief wanted me to touch on was the legislative updates that are making their way through the Oregon legislature. And so about a month ago, late April, there was 9 different bills that passed the House. They are in various stages. I checked today, various stages of passing through the Senate. They've all had a public hearing. Most of them have had a workshop meeting at this point, but none of them made it to a vote on the Senate floor yet. And then there's 5 more police reform bills that are still under consideration through the Ways and Means Committee. And so those have not been presented to the floor of the House yet for any type of a vote. But all of the rest of those continue to make their way through the Senate. Those 9 reform bills, and they shouldn't face any significant challenges from the Senate. They were all most of those challenges that were there were worked out when they before they voted on those on the House floor. So that's really about it at this point that the chief wanted me to pass on. Are there any questions I can answer on that stuff at this point?
Valerie, I see your hand.
So because we mentioned it at the last Public Safety Advisory Board meeting, I just wanted to find out if you had any idea, if your office had any idea about timeline from the AG's office on their review of the investigation.
No, we still don't. We haven't been given a timeline to my knowledge.
Okay.
So I'm sure the chief would have passed that on if she had one. So, yeah.
Fair enough.
Thanks, Valerie. And Justin.
I had one comment and one question. First, the comment was just to add on to Commander McDonald's update. As someone who was required to watch the committees this morning in Senate Judiciary, a handful of those 9 that Commander McDonald just mentioned did pass their work sessions with a due pass recommendation from the committee, which means they will be handed to the Senate floor within the next week to week and a half for a vote by the Senate. And then additionally, my question was actually to track back to something that Commander McDonald had touched base on a few weeks ago when we were talking about I believe it was the psychiatric evaluations or pre-screening evaluations for potential officers to the police department, and if some questions were culturally responsive and if there was any data regarding those. And I know that Commander McDonald had touched on it, and so I was just wondering if there's an update on that information.
Yeah, so the psychologist that we use, in the conversation I had with her, she is working on a new, I believe the term she uses is tool that they use for evaluations, and it will have those, it will have more of those culturally responsive questions in there that are scientifically supported for evaluation. So she was waiting for some feedback from some of her colleagues before she implemented that. But I anticipate in talking with her that probably our next candidates that we send will be evaluated using that tool. So in the near future, she said that it's just that particular evaluation model is kind of an imperfect science, and they're trying to get something that's more reliable. And obviously she doesn't want to implement something that isn't reliable when doing those evaluations. So the way they do it now is they use the questions and use some of the information that we gather in the background, because the psychologist reviews the entire background prior to the evaluation that they do with prospective officers. So she then asks questions out of that currently, but she's hoping to have actually a scientifically proven tool to be able to use that'll be more effective in that particular area.
It's great. Thank you so much, Commander McDonald. And also I want to express gratitude for just the immediacy that you were able to take that request and then translate that into an action with the psychologist. So thank you very much for that.
You're welcome.
Liz, I see your hand up.
Thank you. Hey, that's okay. Hey, Jamie, in case there's members of the public watching and they may not be familiar with those bills, I think there's a way they can check online. I know as a city councilor, I get a regular report. So could you maybe pass that on and put that in our minutes or something? So if there's folks watching and they're wondering about those bills, they could get that information. I know it's available, so I appreciate it. Thanks.
Yeah, I'll send Eduardo. I'll send you the 9 bills that have passed the House that are being considered by the Senate. So I'll email the bill numbers to you on each of those that have already passed.
That sounds great. I'll include them in the minutes and post them on our website as well.
Excellent.
Thank you. And I don't see any other hands, John.
Thank you. All right, I have the special honor of introducing our next couple guest speaker, Kristen Burke. I know Kristen for a long time. Kristen used to be the mental health division manager for Washington County, Health and Human Services. And I think she transferred into a new role in terms of special project supervisor. And along with her, I believe on my sheet, I say Under Sheriff John Koch, but I don't think Under Sheriff is with us, or is it someone else, Kristen?
Yeah, we have the pleasure of Al Roquet. I'll let Al introduce himself real quick.
Okay, Al.
Thank you. Hi, everybody. Thanks for having us tonight. It's our pleasure to be here. I'm the Chief Deputy of the Enforcement Divisions, which includes our Patrol and Investigations Division. So I report to the Undersheriff. He had a family emergency today. So I'm the sub that you get. Hopefully that'll be okay with you.
Sounds good. So we have both in terms of Health and Human Services, in terms of the Mental Health Division, and also the Sheriff Division to talk about in terms of our mental health response team. So with that, I believe, is there going to be a presentation being provided by you, Kristen?
I do have a presentation. I'm going to try and share my screen. I understand we have a backup just in case my screen sharing doesn't work. So let me give this a shot, and if it doesn't work, we'll quickly shift.
You're co-host, so it should work.
Okay. Let's see. Did that work? Excellent. Okay. I'm going to just make this a little bigger so I could still see a few of you, because it's nice to be able to see. Unfortunately, I can't see all of you. So if you have any questions, I don't know if you can raise your hand and maybe Kim can identify, and then just interrupt me is fine as well.
Great. Yeah, I'll be able to see raised hands and I'll let you know.
Wonderful. Thank you.
No problem.
Okay, so any conversation about our mental health response team, I'd like to always start with just a little bit of context so that everybody understands a little bit about the Washington County crisis system. And when I say crisis system, I'm really talking about behavioral health response for individuals who are experiencing heightened symptoms, maybe thoughts of hurting themselves, thoughts of hurting other people. But it's really the genesis is a behavioral health condition, whether that's mental illness or substance use or intoxication. So we actually have a relatively robust crisis response system in Washington County compared to a lot of parts of the state. So in the Portland metropolitan area, the 3 counties all have very similar crisis response systems that have various components to it. So I'm going to talk specifically about what we have in Washington County. First of all, we have a crisis line that is available 24 hours a day, 7 days a week. It is unique to Washington County, meaning Washington County residents have access to a phone number that will go to clinicians that can really provide a response and coordinate with other crisis response systems in Washington County. So there are other national crisis lines. You've probably heard of Lines for Life, suicide prevention lines. We also have our own crisis line in Washington County that just is really integrated with our various crisis response systems that we have here locally. So that's nice to have. It is operated by Multnomah County. They have a crisis line themselves. And so the nice thing about it is because they have a limited scope, they really are able to coordinate very closely with us. And so they know our crisis team members, and they know a lot of the people who call, and they can provide some really specialized support for those individuals. We also have what we call the Hawthorne Walk-In Center. That's a behavioral health urgent care center that we opened a few years ago here in Washington County. It's much like a medical urgent care center where if you have something that you need help for relatively quickly, you can go and walk in. You don't have to have an appointment. There's master's level clinicians available who can assess what's going on, provide resources, provide crisis intervention. It is located up in Hillsborough off of Elam Young Parkway. It's actually right on a MAX station. So people who are on transit can literally exit the Hawthorne Farm MAX station, and the center is right there. It's open 7 days a week. Right now, the hours are somewhat limited. We've had some challenges with COVID in terms of being able to support people. And so the hours are reduced at this point, but we hope to expand them back up. But it is available 7 days a week. The Hawthorne Walk-In Center also acts as a hub of crisis services in Washington County. So our other crisis teams are also located out of Hawthorne, including the mental health response team. And the clinicians at Hawthorne Walk-In Center can also provide a mobile crisis response, which means the clinicians can leave the building and go out to individuals in the community to provide some support if that's the right response for them. They can also go to the jail or to emergency rooms. They really can go to where the need is. So I'll talk about the mental health response team in a second here, but the other thing I wanted to mention is that we have a team called our peer crisis supports. And so this is a team that's made up of individuals who have life experience, people who have their own behavioral health conditions, people who have been through the crisis system in the past. They can provide a level of support and connection with people that professionals often can't. So the peer crisis team will connect with somebody who's in crisis, help them navigate, help them identify what their options are, really provide support from that perspective of, I've been there and this is what helped me. And then they can continue to provide support and follow up even after the crisis to help people get connected to services. So it's a really important component of the program, and one that we think has really led to much fewer holds, mental health holds in our communities, and fewer admissions in the emergency departments for mental health conditions. So now I'm going to talk about.
Real quick, Kristen, we got a couple questions. First from Valerie.
So Kristen, I really appreciate your coming. So thank you so much for doing that. This is so important, the work that you do, and also, to the work of this committee. And I guess one of the questions I have is when you have this clinic that's based up in Hillsborough, is it primarily seeing people from a geographic radius, circulated around Hillsborough and around the campus site? What percentage of the folks you're seeing are actually coming from Tigard or South Washington County?
So I know that there's always concerns about access in South County, and we understand that. We had hoped to locate the center much more geographically central to the community, and we just simply couldn't find any property that would work. And that's been an ongoing challenge. So one of the things that we wanted to do is we'll talk a little bit about our proposed expansion and how we hope that that will meet the needs of South County. But we did actually very purposely locate it on a max line because we did transit evaluations and found out that having anything on a max line was so much faster for anybody, no matter where they are in the county, than than on a bus line, essentially. So that was the one thing that was helpful.
Okay. Thank you.
And we got a question from Jeff.
Hey, Kristen, thank you also for coming in to talk to us about this. My question is just around, are all these groups paid positions or are any of them volunteer positions?
These are all paid positions. And so we have a contract, and I'll actually talk about the contractor here in just a couple of minutes, but this is services that are funded through a real mix of funding sources, both Medicaid dollars, state general fund dollars, county general fund dollars, but they are all paid positions.
Thank you.
Yep. Any other questions?
No other hands.
Okay, great. So let me talk a little bit about the mental health response team. So this is a team that's, we started it about 10 years ago, and it's a team where we take two different disciplines and put them together to provide a different kind of response. So we take a mental health clinician, a master's level clinician with experience and a specialized training, and we place them in a car with a deputy. And so what that does is it allows for a rapid response to crisis situations and really two unique skill sets. You've got the law enforcement officer who is, all of our law enforcement officers are CIT trained, crisis intervention trained. So that means that they've had enhanced training in crisis intervention and responding to behavioral health situations. So they can really assess for any safety concerns. They can really get some additional information from the law enforcement system about, are there known safety concerns at the location? Have they had contact with this individual in the past? But then you have a clinician who also has access to information from the clinical side, and they can assess the situation and provide an actual clinical intervention on site. One of the biggest challenges we've had with our mobile crisis team is being able to get the team to a person rapidly. It can take a long time, especially when there's traffic, to have clinicians actually get to the site where an individual is in crisis. Having a mental health clinician in a law enforcement vehicle allows them to get there very rapidly and assess the scene very rapidly. So like I said, we've had this team set up for 10 years. We started it pretty small. We started it as a pilot project with just a single deputy and a single clinician. And then we've grown it over the years because we immediately found that there was a real benefit to having the two different disciplines sharing information and sharing a response. The thing that's really important to know about this team is that it truly is a diversion model. Even though we have a law enforcement officer who is responding, the goal is to get people into treatment and really connect them to care. And so it really truly is focused on diversion rather than kind of a law enforcement aspect. The fact is that a lot of the calls for mental health crises go to 911. And this is a way that we can be responsive to those calls and in a way that's really clinically informed and responsive to the individual. The other thing that's really important is that it's not a one intervention, one-time contact, and then that's it. The one thing that they do is they really connect and provide follow-up for the individual. So maybe the next day, a couple days later, they'll do outreach. They'll have follow-up appointments to connect. It may not be the mental health response team that connects. It could be the rest of the crisis teams, or they might make a referral to the peer crisis support team. So they're really integrated with the rest of our crisis program. And so they can come back and provide additional supports to the individual after the initial crisis in a way that's really responsive to what that individual needs. So currently we have 2 teams on every day, and they cover from 11:30 a.m. to about 11 p.m. They are able to go anywhere in the county. So even though it's a Washington County deputy, they can go into cities. However, they will wait until they're either invited in, or if they hear a call that sounds like it has invited in by the local jurisdiction, law enforcement agency, or if they hear about a call on the radio that sounds like it has a mental health component, they may call up the officer and say, hey, can we support you? Is there anything that you need from us? Can we provide you with information that might help? Would you like us to come on site? So they are able to provide responses within cities as well as in the unincorporated areas of Washington County. I'm going to actually have Al speak about the statistics here, if he wouldn't mind. We just have a couple of slides that have some of our statistics for the team.
Thank you, Kristen. So this chart just has the last 3 years. The asterisk on 2020 is the big asterisk that everybody knows about for that year being, thank goodness, over, but also weird and throws numbers off. And so it's hard to use that year in trends to include calls for service. But overall, the team, and again, it's 2 teams per day, 7 days a week. So we're only talking about 4 people across the entire week. Somewhere between 4,500 and 5,000 calls for service is normal. And if last year didn't have a pandemic, we would, I guarantee you, have seen that number continue to rise. Of those calls, just the ones for the MHRT team is the next line down, that near 2,000 number. And then the next grouping of data shows where there was actual clinical services provided to those individuals who were in need versus not. It's about a 50-50 split. And then finally on the slide is the patrol support calls. So these calls initiate something that's not obviously mental health component to them, and patrol gets there first, of course, because they're the first responders, and they arrive and realize, oh, okay, this is not just a theft in progress or a welfare check on somebody sleeping on the ground. There's a MHRT component, and so that actually is a bigger chunk of the calls for service that the team responds to. Next slide.
Should be up.
Okay, it hasn't painted on mine, but there it goes. All right, so then Kristen had mentioned that there's a lot of recurring contact. And so if you think about the specific MHRT calls for service from the last slide of being, let's say, somewhere in the neighborhood of 2,000, here's the recurring subject contact component of that. And so it's greater than 50%, and oftentimes it's more like 65 or 70% of the same people having crises over and over again requiring some level of service. Kristen also mentioned that the goal of the program is diversion from the criminal justice system. And I think this middle line speaks volumes to that. Criminal element actually is our way of saying an arrest was made. And so out of these 1,200 in 2018, 88 resulted in a criminal charge. And the rest of those calls were serviced some other way, either no outcome or services provided or something like that, but not entering the criminal justice system, which I think is really what we all are hoping and expecting from a mental health response kind of program. And then the other compelling stat is the last line, which is the amount of force used on these calls. And so again, from this top line of 12 or 1,400, depending on the year, we average just over a dozen times where those result in some kind of force needed to resolve the scenario. So this really directly speaks to the ability, sorry about that, of the program and the participants to use the heightened training and time that is created by having a clinician paired with a deputy to do a lot of de-escalation work to avoid that rush in to basically create a force situation. Everything is done that can be done, factoring the conditions and the safety to avoid using force. Any questions on the stats?
No hands.
Thank you.
So one of the real benefits of the team is that we really try to have the team integrated into the system of care as much as possible. They have wonderful relationships with some of our local hospitals. They are seen as a resource and a support. They really, like I mentioned earlier, they are integrated completely into our other crisis systems. So if somebody is seen at the Hawthorne Walk-In Center, then there's a record of that. And then later, if there's a call for support for that individual in the community and the mental health response team responds, they have access to that information where they can know what already has been provided to that individual, and hopefully continue to provide that same level of support and continuity to that individual out in the community. So that's really helpful to have the team as integrated into other systems as possible. I see a couple hands.
Yes, we've got Jimmy.
Yes, I'm sorry, I'm a little slow on my question, but as I was looking at the numbers relating to various types of calls and whatnot, what does your demographic breakdown look like in terms of reoccurring subject contact, criminal element on mental health calls, and use of force on mental health calls?
Al, unless you want to take it, I'm happy to say. We have a really robust tracking that we do on the statistics for the team. Unfortunately, I can't rattle those off on my head, but I would be happy to gather those information and send it out to the group and have that distributed.
That would be really good. And also, what language skills are involved with your staff, with the folks who are on the mental health team? So if you can, are they fluent in languages other than English? We have a fairly diverse community out here, obviously. And so, I'm guessing that the folks that are on the team are language proficient.
They have access to all sorts of interpretive services. I know that some of our crisis clinicians speak alternative languages, I know we have Spanish-speaking clinicians and then a few other languages. However, I wouldn't say that every clinician is language proficient in multiple languages. That's just, unfortunately, the reality of our world is clinicians are hard to hire. John can speak to this, I'm sure. So. But we do have all sorts of resources for immediate interpretation, language lines, things like that. And we'll use those as necessary to provide support in our community.
Okay. Thank you.
If I could just add to that, a similar story on the law enforcement side of that equation, where the individual deputies on the MHRT team, whether they speak a second language or not will vary depending on the point in time and who's on the team at the moment. The language translation resources are always available, and then the county in general does a really good job, and Jamie could probably speak to this as well, of requesting a translator for whatever incident they have, and those requests go out across all the different radio nets, all the different jurisdictions. And if anyone is working somewhere in the county, that resource is then sent over to where it's needed, no matter who needs it. So we do a really good job within Washington County, cross agencies sharing those kinds of resources.
Okay, and then my last question is, the hours of operation, if I saw this correctly, was 11 a.m. to 11 p.m. So what happens if you receive calls, say at midnight or 1 in the morning or 2 in the morning? What kind of system is set up for those type of calls?
That's a great question. Our mobile crisis team, which is also staff at Hawthorne, they are available 24/7. So even though Hawthorne isn't open in the middle of the night, we have on-call clinicians that are available that can be sent out into the community. Usually they will go in tandem with or they'll meet law enforcement on site just to assess safety, but they can go out into the community throughout the night and in the morning when MHRT isn't available.
Okay, thank you.
Yep, okay.
And we have a question from John, or at least a hand from John.
Yes. Really quick question again. I was sort of slow in terms of raising my hand. So based on the criminal element of mental health call and also use of force on mental health call, does everyone get the opportunity to go through mental health court with the county, or how does that tie in together?
So I'm not the best person to speak about mental health court. Perhaps Al can also share. There's certain criteria for mental health court. There's certain crimes that are automatically disqualifying from mental health court. I believe you have to already be adjudicated. So meaning you had to have already been on parole or probation in order to qualify for mental health court. But Al, do you have more information about that?
No, I'm a little embarrassed to say I don't, more than what you have said, but it is a fairly tight criteria to qualify for it. And that resource is unfortunately another one of those that's limited. And so they do have a limited offering of who can go through that program. But we could also follow up for the group and get some more specific information on that.
And I see Jamie, our commander, might have something to add.
Yeah, in terms of, mental health court, I actually do know a little on that. And there is a very specific set of criteria. And so to answer your question, John, directly, no, not everyone gets referred through mental health court. There simply just isn't the capacity in the mental health court to be able to do that. So like Kristen said, there is a specific set of criteria that people that have been arrested and that have a mental health component to that if they meet those, then yes, there's every effort is made to put them through the mental health court, because the reality is we all know that the vast majority of those cases will be better served through the mental health court rather than through the regular court system. So anyway, yeah, they don't all go through there, but every effort is made. And especially the officers and deputies that are working with people that are people that we go to the same individual time and time again. They'll try and reach out to the district attorney that might be working with that case and make a recommendation to refer that person through mental health court if they meet the criteria. So sometimes people may get referred through there that wouldn't necessarily normally go because a officer or a deputy was proactive to stay after it, and then maybe they get referred through mental health court. And typically for those folks, that's a much better outcome in the end anyway. So.
The other thing I'd like to add on to that just really quickly is, we're really talking about one slice of our response system. We have so many other things that we haven't prepared to talk about tonight, such as we have behavioral health clinicians in the jail. We have care coordinators in the jail who can identify people who have mental health issues and help them get connected to care. We have parole and probation officers that have specialized mental health training. I know one of them actually is a mental health clinician as well. And so we have mental health supports available at many different layers in the criminal justice system, including mental health court, including first response. And I'm actually going to talk in just a couple of minutes about how we did a system evaluation to look for gaps. So I'll get to that in a sec.
Thanks, Kristen. And we've got a question from Justin.
Actually, given the fact that Kristen just said she's going to talk about some gaps, I think for the sake of time, I'd like to hold on some of my questions until she's able to present that, because some of my thoughts might be answered already. So I'll hold for a bit.
Fair enough. And Jeff, I saw your hand go down. Are you also planning on holding? Cool. Take it away.
I'm going to try and be proactive and answer your questions ahead of time, but we'll see how good I do. So this is where I had left off about saying, we really are trying to integrate as much as possible into other systems. And I think that actually the discussion we just had is a really good example of that, we're trying really hard to think about the various touch points where people with behavioral health conditions touch different systems and how can we support them. And so this team is one of those examples of that. I want to just say really quickly that we use a contractor model, and I want to talk a little bit about why that is. So in Washington County, we have a model where the county itself doesn't provide treatment services for behavioral health conditions. What we do is we contract out with those experts, such as John's organizations and other organizations, community behavioral health organizations in the community, that have the infrastructure, they have the expertise, they have the knowledge, they're engaged in other systems as well. And so we contract with those organizations to provide the treatment. What the county does is we provide care coordination. We also look at systems coordination. We take that higher look at, where there are gaps, where we can, really allocate resources, that sort of thing. But we really will contract out with organizations to provide the clinical services. So in the case of crisis services, we contract those out to LifeWorks Northwest, who's been our crisis provider for over 10 years. Let's see. So now here I'm going to talk about the gap analysis. So we were just talking about this here a few minutes ago. So one of the things that the county does is really we take a look at our system of care on a routine basis and try to identify where improvements are needed, where investments are needed, that sort of thing. So when you talk about the crisis response system, there's actually a specific model, an evidence-based model that is used nationwide called the sequential intercept model. And what this model is it's a structure for evaluating your crisis response system of care and identifying very specific points where individuals with behavioral health conditions may come in contact with law enforcement or criminal justice system. And the goal of it is to divert people from the criminal justice system. And it's in different steps, if you will. And so there's what we call intercept points. And those intercept points range from before a person ever comes into contact with law enforcement, the point at which they come in contact with law enforcement, when they go into the criminal justice system through the courts, if they go into the prisons, what sort of prisons or jails, what sort of supports are offered there. As they're released, what sort of supports and services are offered there. And then how do we prevent people from re-going into the system? And the goal is always to intercept as early as possible, meaning providing supports as early as possible to prevent a person from going any deeper into the criminal justice system. So we did an evaluation in 2015. That evaluation actually led to the recommendation to build the Hawthorne Walk-In Center to add additional crisis services. And then we had also recommended that we create a position for a jail diversion coordinator. And so that is a position we created back after the last mapping process. And that individual has been working very diligently for the last few years to try and improve our crisis response system for people, improve our coordination with law enforcement, and ultimately to try and prevent as many people with mental illness from going into the jail as possible. So we recently decided it was time to refresh the 2015 evaluation. And so we started, and actually in the fall, we started a new evaluation to update it. So our jail diversion coordinator, who I should also say, he does a lot more than this. I mean, he helps coordinate CIT trainings, the crisis intervention trainings for law enforcement, as well as other things like that. He worked with the Behavioral Health Division and then the Oregon Health Authority to start a new mapping process. The Oregon Health Authority contracts with what's called the Oregon Center on Behavioral Health and Justice Integration, and they're experts at this. So they go into various counties across the state and really help facilitate this mapping process. What they did is they brought together a group of individuals. It was a rather large group. It had over 50 people from various disciplines, hospitals, law enforcement, all these different disciplines, to really review our current crisis response system and then update the map that we had previously. And really, again, with the goal of looking for gaps and what are things that we really need to be focused on. From there, they developed a recommendation for service expansion. They created a report. They did a couple focus groups with community members to receive feedback on the report. And then they developed a list of recommendations. One of the key recommendations that came out of that mapping process was to expand the mental health response team. Now, it wasn't the only recommendation. There was also a recommendation to create an emergency detox center, create a mental health liaison position with courts. We have lots of other liaison positions like a behavioral health liaison with the jail. They felt that having a liaison with the courts would be another way to help identify how we can support individuals with behavioral health conditions who are in the court system. Expand shelter bed capacity and expand substance use residential treatment capacities, specifically focusing on supporting people who have both behavioral health or mental health and addictions conditions. So I'm happy to say that we actually have a lot of work going on in all these areas. We are currently exploring the possibility of creating a detox center in Washington County. We also are working on expanding shelter bed capacity through the Metro Supportive Housing measure that passed. As part of the process for expanding our detox services, we're also looking at residential services and whether we can expand those. So that's work that's already happening. And then the other thing is that we're actually already working on expanding the mental health response team. And so I'm actually going to bump it back over to Al and see if he wouldn't mind talking about the expansion efforts that we're working on.
Thank you, Kristen. As we said earlier, there's 2 teams per day, overlapping shifts, 7 days a week. What we didn't mention is there's also a full-time patrol sergeant who is dedicated 100% to MHRT supervision. And we also have a small group of deputies who are cross-trained to backfill and support when one of the full-time MHRT deputies is sick or on vacation or has to go away to training or something like that. And so there's more than just 4 deputies and 4 clinicians, but that's basically what you see on the street at any given time. In terms of expansion, currently Beaverton is in final stages of budget approval for funding in the coming fiscal year a full-time clinician and an officer. So adding another team right there. And their focus will be primarily Beaverton, but be utilized around the county as needed, depending on where the crisis response is needed at the moment. Hillsborough has also already approved half a clinician and a full-time officer to be a part of the team. Again, their primary focus is going to be around Hillsborough, but they could be utilized in other areas. And then actually just earlier today, I was in a meeting with Jamie's partner, Captain Rogers, and your city attorney, and that's on the call, Shelby, hi again, with the South City leadership to talk about a project that we're going to kick off this coming fiscal year to have a full-time clinician and officer pairing to work mental health calls and be a part of MHRT. This team would be a 40-hour team, and there would be some joint participation between Tigard, Tualatin, and Sherwood. And then the county MHRT team will actually supplement another 30 hours a week. So there's 7-day coverage, not 24/7, but at least one team per day that's focused primarily in the South cities. And I don't know if you want to elaborate a little bit more on that, Jamie, or if that's good for now.
We kind of talked about it a little bit, the concept of the model here a few weeks ago. So unless there's additional questions, that probably covers it.
All right, I see a hand.
There is a question from Valerie.
All right, I was just wondering about timing on implementation. You said this year?
This coming fiscal year. So there's final budget cycles between all our agencies that are happening right now. So that's kind of the first hurdle, and nobody really foresees any problem there. The next hurdle actually is going to be hiring clinicians. So LifeWorks is the company that we partner with for the clinicians. There's a shortage of clinicians, both for this kind of work. There's actually, I think Chris Miller, who's the director at LifeWorks, said in the earlier call, something like 7 current clinician vacancies at the Hawthorne Walk-In Center. And so we all think that that's going to be the major timing issue to address those vacancies, to get these positions that are new hired in. So we're going to do it as quickly as we can, and we'll probably have some hybrid form of that so that we could get like South City officers who are going to participate in the program trained up and start riding along and kind of intermingled around different parts of the county. But all those kind of details are still kind of getting worked out.
Okay, great, thank you.
And we have a question from Jeff Mott.
Thanks. Just looking at the model, the clinician and the officer together, I'm curious why this model was chosen. Saying if we compare it to the Cahoots model, for example, where it's just clinicians, and I want to say it's like 1% of their calls for service result in needing support for police. So just if you could walk me through the decision. I know it's been 10 years since it was started, so.
I'm happy to start this off, and then you can fill us in. Yeah, I actually have known about the Cahoots model for a very long time. I worked in Eugene before coming up to the Portland metropolitan area. One of the things to know is Cahoots is a very different model. Cahoots is not a mental health crisis response model. It's a street outreach model, and they do a lot of support, and they serve a very small geographic area, and they do a lot of homeless outreach. They bring resources to people, that sort of thing. But they don't have master's level clinicians responding. And so what they end up doing is if they encounter a mental health crisis, they will call in a crisis clinician to come and assist. And so it's really a different model. It is really an important component, right? And I think it's a wonderful outreach and model that we need to develop some of that. And I think we are going to develop some of that through our homelessness measures that we have, where we'll really focus on outreach and support to our houseless populations. But what we really felt we needed was crisis response from a clinical perspective to support individuals. So they really are 2 very different models. And we did actually meet with the Cahoots staff, I want to say just a few months ago, and they're really envious of MHRT, so they said they'd love to have that sort of response as well. I think that we would love to integrate more emergency medical support into our crisis services, which is what they have, because they use an EMT with a clinician or with a non-master's level clinician. So we've had conversations with Metro West about could we look at partnerships around that sort of model as well. So that is something we've looked at.
Awesome, thank you for that.
Thank you. And we have a question from Justin.
Hi again. I'm glad that I held on my questions because a good amount of them were answered, but I do have a couple that I wanted to run by you, Kristen. First is, since we're seeing now that the other cities are going to start covering the costs for their own teams and their various jurisdictions, I'm curious now, will they, in your draft model currently, if all goes well with these hires and these budgets, will they all be running in the same like peak period times of 11 a.m. to 11 p.m.? That's my first question.
Yeah, we are evaluating that. What we want to do is spread it out more so that we have more morning coverage and then later in the evening coverage. Overnight's really challenging when you get to that 1 a.m. to 6 a.m. Not much happens, and it's almost hard to justify having a clinician stay up in the middle of the night and pay for that, whereas we can use an on-call model. But we are definitely evaluating whether we can stretch the hours of response out as we're expanding to add more teams.
Got it. Thank you. And then attached to that, the same question, I know that you mentioned that you switched to the behavioral health mobile crisis team in the later hours when you don't have MHRT available. But I also know that you mentioned earlier that sometimes it's difficult in terms of getting folks out there in a prompt amount of time because they're not directly with the officer. I just wanted to know if your team has noticed a difference in outcomes when you end up switching to the late night hours and utilizing that model, and if there have been any positive outcomes or there are negative differences when you switch to that.
I would say that's a little hard to answer. You ask really tough questions, but I appreciate it. But what I'd say is that the reason why that's hard to answer is because the team itself doesn't do just a single intervention and then walk away. They're going to follow up with the individual the next day. So the intervention that happens in the middle of the night might actually only be a phone intervention if that's adequate for that individual. The clinician can talk to them, come up with a safety plan, plan to see them at the clinic the next day or come out the next day. That might be the intervention, or the clinician may need to actually go out. It really is just a case-by-case basis, whatever it takes to help that individual at that moment. So that's where it's a little hard to say the outcomes, because when I think of outcomes, I'm thinking of, did the person get connected to care, and are they in a better space after a certain period of time than they were at the time of the crisis? And hopefully that's the case for the vast majority of people we're supporting. It's just how we provide that support may look different.
Got it. That makes sense. And I appreciate you explaining what that follow-up could look like depending on what that initial response is. That's really insightful to know about. And I appreciate you fielding my questions.
Sure. No, they're great ones.
Great. Let's see. Thank you, Justin. And there are no other hands.
Okay.
So the last item on this slide is just a reference to TriMet. That's still being worked out. In case that caught anybody's eye, we're still finalizing interagency agreements and what that would look like. But TriMet is also interested in doing something similar to what we're talking about with South Cities, of providing a clinician deputy team whose primary focus is on West Side TriMet, not Multnomah County or Clackamas County TriMet. It'd be West Side. And they would, it'd be interesting because this component would give a lot more, it'd be less geographically bound because TriMet goes through all the major cities. So that would have an extra team resource available for responses in a lot of different ways. So if you go to the next slide, I think it was Mr. Brown earlier started the after hours conversation, what happens after. And Kristen mentioned we're looking at expanding the hours of coverage. Having these additional teams of clinician and officer deputies are giving us more ability to look at really focusing those teams at times when the need is the greatest. The other thing I wanted to say about the calls and the needs and the times is we strongly believe that once we have a South Cities focused MHRT team, this coming fiscal year, we're going to see a significant increase in calls for service in those South cities. And that's just a natural consequence of having, more awareness of a resource that maybe some people know, but not everybody knows real well, or some people have less comfort in calling a different jurisdiction for some service, specialty service than other jurisdictions. And so what we tend to see whenever something like this becomes part of an integrated offering within a jurisdiction is it gets utilized much more than anybody expected.
Thank you. We've got a question from John.
I'm just curious in terms of just general question, for the master level clinician, why are they partnering up with the sheriff department and not the local PD?
Wow. It started with the sheriff's office because we actually had a deputy who was our liaison with the sheriff's office. And he was the one who came up with the idea of putting a clinician in the car and starting MHRT in the first place. We've actually wanted to expand to be an interagency team with all of the different law enforcement agencies in Washington County for quite a while now. But there's been a variety of starts and stops, and now it seems like the momentum has happened and everybody is really excited to get on board with creating an interagency team where it won't just be sheriff's deputies. It's going to be some of the law enforcement officers will be deputies. Some of them will be Hillsborough Police, Beaverton Police, Tigard Police, so it really truly will be an interagency team at that point.
And the other piece to add to that is, and Kristen could speak to this way better than I can, but being connected to the county health system and sharing of resources and that kind of information is a vital component. And if, let's say, a city wanted to just hire their own clinician and pair them with an officer themselves, they would not be integrated with that overall system. And you could probably say that a lot better than I did.
Yeah, one of the real benefits of our having Hawthorne as a hub of crisis services is they use a single electronic medical record. And so they can start providing support to an individual, come up with a plan, and then any other one of our crisis teams that might see that person later has access to that support plan, kind of already knows how to serve the individual. And so there's a real benefit from having it all together into one team because of the robust information and the ability to follow up with that individual, because people don't stay in specific geographic areas. They move around a lot. And so we're able to provide more continuity of support to them by having a single record system that can help with the response.
Great, thank you. And we've got a question from Valerie.
So, I mean, to follow up on that point, I have two questions actually. So to follow up on that point, is the medical record system that you use Epic? Because I would imagine that that's the one that's more widely used between, regular practitioners as well. So, it's not, or is it proprietary to Washington County?
No, it's neither actually. We would have loved Epic, but they refused to respond to our RFP because we weren't big enough. Epic is a very huge system that serves whole hospital systems, and the county didn't have a big enough. So anyways, so no, we have a medical record system that is run by the county, but it's a platform called Dr. Cloud, which is run by actually a local software company called InSoftTech. And so the county owns the system, owns the data, but LifeWorks uses it. And so the crisis team actually puts their information into the county system so that we have access to it so we can provide better support.
Sure, no, I appreciate that. And I really appreciate your breaking down the difference between the Cahoots model that we've been hearing so much about and, this crisis response model. Hearing you talk about it, though, it doesn't sound, it sounds to me that they may be compatible models, right? Where you would have, compatible models where you might have a street routes type approach, but then for, events that are called into 911 or that may have a more criminal component to it or potentially criminal component to it, you know, the mental health response team would go out and address those as well. Are you aware of any situations where people have sort of these complementary models, one that's more boots on the ground and one that's more law enforcement oriented?
I would say Portland's probably closest with their pilot with the Portland Street Response. So because they also have some similar programs to the mental health response team, and then they have that as well. But I think, you know, they're just in the pilot stage.
Sure.
Like I said, one of the things that is really exciting right now is that the county is working on implementing how to expand our homeless outreach and support. And, you know, the intent is to functionally end homelessness in Washington County. And part of that really is outreach. And so we're going to be looking at, you know, what are the services we currently have, and then where are those gaps in terms of that sort of support where maybe somebody isn't in mental health crisis, but we can get ahead of any crisis by offering other supports and connection into services and that sort of thing. So that's hopefully the direction we're going to go in terms of expanding that. That said, we're always evaluating opportunities such as really pairing with EMT or medical services to see if there's other ways that we can expand. One of the hard things that we have in Washington County is a big geographic span.
Right.
If you look at the Cahoots model, it is only Eugene city limits. It's about 77 square miles. Washington County is like 700 and something square miles. I'm sort of making that up because I really don't know, but it's a lot bigger than 77 miles. And so they can stay very limited and can provide very rapid response because it only takes 15 minutes to get from one side of town to the other, whereas you can spend a long time driving to get from one side of Washington County to the other side. So that sort of model works really good in condensed geographic areas. It would be harder to implement in a really dispersed geographic area. But that doesn't mean it's not something to look at.
Well, and there aren't any nonprofits that are operating in that space that you know of in any of the smaller towns in Washington County. So no Beaverton or Hillsborough or, okay.
No. And again, I think one of the things that if any of the towns did look at expanding that model, we'd want to have a conversation about can we integrate them in with the rest of our crisis teams so that they have that support and, you know, that continuity where they can really make sure that we're sending the right support out to individuals at the right time.
Absolutely. Thank you so much.
You bet.
Great, thank you. I do want to be cognizant of Kristen and Al's time. I think we only had them through 6:10, so I'd like to give them a couple minutes to complete their presentation.
The only thing I was going to finish with on this last slide is that this expansion that we're talking about doing would, in essence, double the offering of team members for responses, and that would broaden the scope. The way it works today on a daily basis, you'll have an MHRT team on duty who is providing phone support to an incident somewhere in the county, regardless of where it is, whether it's in Tigard or Sherwood or Aloha, while they're responding to another call, while they have two more holding in our queue, what we call our queue, waiting to be serviced. And so the need is there. It's obvious. And I think if we put more bodies at it, we're just going to be able to realize and service more, but we're going to also realize that there's a much bigger need than we anticipated. And the other part that's super challenging in terms of response models and who responds to what is more often than not, and I'd say probably 60 to 70% of the time, our initial information that comes in through a dispatch center is not really wholly accurate and certainly not complete. And so most of the time, we're responding to something with very little known components to it. And that makes it challenging for anybody to decipher which team is the appropriate responder for this particular incident.
And I'm just going to say really quick, that was our last slide. So I'm going to stop sharing and so we can just answer questions.
Are you comfortable staying on to answer some more questions?
Sure.
Great. So I've got a hand from Jimmy Brown.
I'll be really quick. as you prepare some information relating to demographic data that you have, could you also include in that information what percentage of your calls are involving houseless individuals and families?
If we have that available, certainly. Yeah, I'll look into that.
Okay, thank you.
Thanks, Jimmy. And I see the commander's hand.
Yeah, I just wanted to say that as an agency, we really support this this interagency team. And I mean, fortunately, and Al can speak to this as well. We in Washington County, we work really well together in interagency work. So it would be a really nice fit for some of the other things that we already do countywide for multi-jurisdictional teams. So it's something that's definitely workable. So we would see a Tigard officer actually go to Sherwood or maybe to Beaverton to respond to some of these calls, just like we would also see sheriff's deputies coming into Tigard and Tualatin like we currently do. And seeing a Beaverton officer, maybe, for example, coming down to Sherwood, depending on what the situation was. So this countywide model is not new to law enforcement agencies in Washington County. We do this regularly. So it's something that we as an agency would be very supportive of. It, as you can see by the presentation, it's a force multiplier for us to be able to, and for the county-wide. It provides resources for not just our area, but it's that depth of service to the community that we're going to be able to provide by having more involvement with this team.
Thank you, Commander. And I see Emilio's hand.
Yeah, I was just wondering, since you mentioned it, how often there are callers like in the queue or waiting to be responded to, and if that is often, how long their wait time is?
Yeah, thanks for the question. It varies on the day. I'll say that much. And so it's hard to. It's a regular occurrence, but it's not all day long every single day. And in between those calls, oftentimes the MHRT team is actually doing some of that follow-up service that Kristen mentioned earlier. In terms of response times, that's all a factor of level of priority of the incident, right? So the things that are in crisis now in this moment get prioritized over somebody just wants to talk to MHRT because they're thinking about some suicidal ideations. That one may hold for the person swinging around a hatchet, standing in traffic, yelling at cars. So it just kind of varies.
I don't see any other hands. Last call for questions. I don't see any. Kristen, Al, thank you very much for joining us this evening and sharing your knowledge and answering our questions. Greatly appreciate your insight.
Yeah, thanks for having us. This has been a great discussion, so really appreciate it.
Yeah,
Our pleasure.
I just want to say thank you, Al, because I mean, I worked with the MHRT team for the longest time. I think they're great. I think the partnership with Life with Northwest is also awesome. Keeping my finger crossed to be able to, for you all to expand to double your team. So good luck on that and hope to see you guys around.
Great, thank you.
Thank you.
All right, thank you, everybody. Great presentation and great questions. Let's go ahead and move on to our next agenda item, which is talk about in terms of the Tigard body camera policy. So I'm going to pass it over to Kim to facilitate that discussion.
Yes, we are fortunate that we have Sergeant Erickson with us again this evening to answer any questions about the body cam policy. We've all had it now for about 2 weeks. So if you have any questions and comments, the floor is open. And Liz, I see your hand.
Thanks, and I appreciate the opportunity to look at the policy. My questions are really more just kind of a general comment around the training. The policy seems to read like that it would be used for the current cameras. So there's some things about when they're activated and storage and things like that that I am assuming might need to be modified around the current cameras. So maybe that's a nuanced thing, and maybe I have my old, assistant city manager hat on, but seems like there might be some clarity around that. The other thing, when we talk about training, and this is another small detail, but the importance of the officer acknowledging that they've had the training is important, to get that sign off. I don't see that. Maybe that assumption is made, but I know when I was working at the city, that became important on a couple of occasions to make sure that was happening. So, when the cameras are activated, that policy might need to be updated. The expectation of community members for release, you talk about that, which I think is important, but I think the community might want to understand that or know how that's going to work. There's obviously some laws that apply. So I just think in these times, just some clarity for community members about, the release of that. And then the personal recording. I noticed there was some information about when someone may or may not personally record. That was a little unclear to me. I didn't really understand that portion. And then this retrieval on the storage, I think that's going to be different since we're on the cloud. So I'm getting down into the weeds a little, and I apologize, but it may be when the community looks at some of this, if they do, they might have the same kind of questions. So that's my comments. Thanks.
Thanks, Liz. Lee, did you get all that? And do you have anything you'd like to respond?
Yeah, I think I can address the first couple regarding the training. So training acknowledgement is going to be handled fairly easily. We do a lot of our training virtually now through a platform called NeoGov. And so when the officers review the training, there'll be an acknowledgement at the end of it that they have to click yes, that they reviewed the training and sought clarification on anything that they were unsure about prior to us issuing the cameras. And then that's recorded in the system. It'll go into their training file and it'll always be there. And then we'll do periodic trainings through the same way to be able to track it and ensure that all that acknowledgement is there. And then training around or the use of the cameras around other devices. These are going to be used in conjunction with our in-car video systems. So these aren't replacing anything. They're going to be used at the same time as in-car video. So if you're in the car and you activate your in-car video, it's also going to activate your body-worn camera. So they'll both be recorded at the same time. Those videos will be linked together. And when we produce the product, it'll show from one view to the next, or both views at the same time, depending on how the person wants to view it. So all that's there. When they're activated, all that kind of stuff covers a wide gambit of what statutory requirement is, as well as based upon when we think it's a benefit to the department or to the community to record that contact, that information is there.
All right, thank you, Lee. And I see a hand from Valerie.
Yeah, so I mean, I had a lot of questions about the policy, and I'm pretty sure that the remaining 40 minutes we have is not going to be enough for my questions, let alone the questions of all the other people who have their hands up. I really appreciate the additional time to look at this. I mean, I think reading through it, there's a lot of sort of squishy language in it that I didn't really understand, that I think is intended to address situations where there may be some ambiguity and rely on the officer's judgment, but, some clarity may be helpful, such as reasonably appears, and expectations and things like that. But, I had some concerns about the retention period. I think the retention period that's listed here is awfully short, given how long the statute of limitations is on some of these claims, and particularly when, you look at statute of limitations on lawsuits the department may become involved in, that you may not always have notice of. Within that period of time. So I think that needs to be expanded. And quite honestly, I think what probably should happen is that we should have a subcommittee that takes some additional time and goes and works with the department and does a line-by-line review of this and then reports back to our committee. because I'm just looking at the hands that are up. I know that people have a lot of questions, and we've had some offline discussions as well to try and, say, well, okay, what are the best resources? What are best practices here? So, to the extent that the city council would like recommendations, I'd propose that one of our recommendations be that we take a deeper dive into this and take some additional time so that we can, have some thoughtful discussion about what the policies look like.
Yeah, based on the hands and already the detail of kind of some of the questions that are coming through, I am going to defer to our city attorney. We will discuss with staff exactly how a subcommittee could be formed out of this, and kind of how Oregon Public Meetings laws and things might apply, and get back to you. But first, is that a consensus of the board to take this or try to investigate whether or not how to do a subcommittee? And if it is, please raise your hands.
And I didn't want to hijack the discussion. I thought, this is a very complicated area that we don't have a lot of time right now to talk about.
And we don't. I still would like to, if there's any high level questions about the policy, spend the remaining time doing that, and then investigate with staff on how to maybe form a subcommittee and how that could work with the police. Does that work? Okay.
Really quick, I'm sorry, Kim. I think the importance is, as I mentioned, and just to echo what Valerie said, a lot of it is around clarity. I mean, I think the intent is there, but I think, a lot of it is just around clarity. So I just want to feeling sort of like the department might be thinking what, but I think there's some some clarity that could be, that we could benefit from some clarity. So that's what I would look for in terms of the subcommittee. Thanks.
I understand. And Commander, did you have a comment?
Yeah, a couple of things I wanted to hit on. So when we went through and made these recommendations, we combed over numerous other agency policies and went back through and looked at legal requirements in the state. And that's how, when we revise and review a policy, that's what we do. We do it based on best practice and what the law says currently. So just keeping that in mind, we've spent a lot of time going through and finding what appears to be the most sound language currently. And keeping in mind, policies are ever evolving because law changes all the time. Best practices continue to evolve. So that's one of the things that we did, is we went through and reviewed and renewed this policy. And so, Liz, to one of your points, and maybe I misunderstood, but you talked about personal use. So the language in the policy prohibits an officer from using their body-worn cameras for personal use in any way. So I misunderstood what you were talking about when you mentioned that, but that they would be prohibited from any personal use of the body cam. And that's actually no change from what our current policy is for dash cams and things like that. So, but I just wanted to.
Sorry, that's what I thought, but that was an example of where it wasn't all that clear to me. So maybe I missed it, but it just, and then I was thinking, okay, are they using their personal phones to record some stuff? So maybe it just went right over me, but it seems like it could have just been more concise. That's all I'm saying. So.
Okay.
Yeah, and having a small committee maybe put together a list of questions, places where clarity is needed. Some language may be very clear to officers and to the city and just need to be clarified for the public. I think might be a good place to start. But I will still open the floor to maybe more general or high level questions or comments about the policy. So I'll start with Jimmy.
Hopefully this is high level. I don't know. I sometimes operate low level. First, I do want to say that, I appreciate the work the department has done in putting together this policy. It's clear you all have done some work on this. I need the department to reflect that, one, I don't believe anyone on this board is personalizing the work that has been done. I think it has been professional. I think you have looked at some resources from probably throughout the country to come up with what Tigard's BWC should look like. And then that being said, the beauty of this committee, this board, is that we provide an entirely different set of eyes and an entirely different set of lived experiences, different from that may be part of a police department. And we do so recognizing that body-worn camera hasn't always been used to enhance the livability of people who have had to deal with the police. So the policies need to be very, very clear in their intent and in their utilization. So that's my preface. The rest of my point is 449.4.1 talks about supervisor responsibilities. And it says, it is not the intent of the department to review recordings for the purpose of general performance review or to discover policy violations. And my question, quite frankly, is why not? Because if you have the body-worn camera and someone is in the process of perhaps being too aggressive, maybe not applying use of force requirements per policy, that camera is going to presumably show that. And this tends to speak to, it's not the intent of the department. And I think for staff, as well as for the public would like to know that, yes, one of the intents of this body-worn camera discussion is actually to ensure that we do have a performance review of staff and that we do look to discover if there, in addition to other elements, if there are any policy violations. I think that you know, the having body-worn cameras makes lots of sense, and utilizing them in order to ensure that our staff or our officers are in fact doing what needs to be done appropriately is one of the primary reasons for having body-worn cameras. Just in my humble opinion, I'll put it that way.
Thank you, Jimmy. And Justin, I see your hand.
Yes, thank you. First off, I would also like to underscore what Jimmy had just mentioned regarding 449.4.1 with supervisor responsibilities. That's something that I had also thought about. My high-level question, and this might be me just not remembering very well, but I'd like to ask a question about 449.9, which is related to the coordinator for this policy. And I just wanted to ask, is it Sergeant Erickson who is the coordinator that is designated to manage this? And then I have a follow-up question based on the answer to that.
Well, maybe. It'll probably be one of the lieutenants, actually, that will be actually the coordinator of the program. We haven't officially identified that, but it's likely to fall under one of the lieutenants. Okay, got it. And then my second question, and this is kind of wading into hypothetical territory here, but are we required by state law that the body cam footage and data is managed and handled by a police agency? Is that a requirement, or is that a preference by the police department?
I think what state law says is we have to own the video. If you're asking who can actually manage it, we can still contract with a vendor to store the video offsite. We don't have to manage the infrastructure to store it on site, but we have to own it. So the contract that we have with the company has to say we are the owners, we have the sole custody of the video, and it can't be used for anything that we don't expressly consent for its use.
Okay. And so then I'm presuming that means there is no possibility of there being an independent non-police individual who is participating in oversight, based on my understanding of your response.
I believe so.
Okay, thank you. I appreciate that answer.
Thanks, Justin. And John, I see your hand.
Yes. I appreciate in terms of Jimmy Brown comment regarding in terms of supervision, that kind of stuff. I echo the same concern because it is useful in terms of being able to evaluate the footage and use that in supervision and so forth. The other question I have is regarding release of footage. Would there be any time where redaction are needed? And if so, who's in charge of doing the redaction?
So yeah, obviously there'll be the need for redaction if there's videos that involve juveniles, or if somebody has a privacy interest, like if we're inside somebody's house, those kinds of situations. And typically redaction is going to be handled by our records department and our property and evidence specialists. So non-sworn staff that support the police, they know all the laws that regard retention and release of information, that kind of stuff. So they're the ones that would handle the redaction of the video. And the part of the system that we purchased covers that part, or does redaction somewhat automatically for us. So you can select faces and it'll automatically blur faces out throughout the entire video for us. So it's not super labor intensive, but it still takes quite a bit of time to redact videos.
Thank you.
Thanks, John. Any other questions about the policy? Jeff, I see your hand.
Yes, thank you. I think Jimmy put it so well around the perfect marriage of this board with community representation and the police department coming together. Because like Jamie, you said, you guys have done a ton of work looking at best practices from police departments and at Oregon state law. Whereas I think a lot of us are coming from a different angle around accountability and transparency and equity, and maybe looking at best practices from civil rights organizations' recommendations. So, like I think that's at a high level. I would support a subcommittee, and if not, probably like 2 or 3 of these meetings to go line by line down the proposal. My question for today is in section. It's at the very beginning, 449.1. Just around it does not this policy does not apply to mobile audio or video recordings. Later in the policy, in this policy somewhere, or it's in the records and maintenance, talks about how if police officers are not allowed to use their mobile devices unless expressly approved by the watch commander, I believe, something like that. So if the watch commander approves police officers to use their mobile device to record, why wouldn't this policy also apply to those mobile recordings?
Sorry. Yeah, I'm not sure where you're finding that other part about the watch commander authorizing their use.
It's on 449.6, prohibited use of portable recorders. Members are prohibited from using personally owned recording devices while on duty without the express consent of the watch commander. Any member who uses a personally owned recorder for department-related activities shall comply with the provisions of this policy, including retention and release requirements, and should notify the on-duty supervisor of such use as soon as reasonably practicable. I think that's what.
Thanks, Jamie. So it sounds like it's just the language is contradictory in a couple different places.
Yeah, and I think that's probably a artifice left over from the previous version of the policy where we didn't have department-wide body cameras to go out to everybody. I think we can look at excising that particular paragraph out of the policy now that we'll have everybody has a body-worn camera, and we'll have spares on hand in case something breaks. Nobody's going to have to use their own personal device and get permission from some watch commander to do that.
Great, thank you.
Sorry to interrupt. That was the section that was confusing to me. So Jamie, that was what I was confused about on that section. Thank you.
Thanks, Liz. And Jeff, your hand's still up, but I think you're good. Valerie.
So, you know, I think what we're probably going to recommend is that we do a deeper dive if possible into this. But one of the things that I wanted to, actually, I think it's more of a question for Shelby because she's involved in more policies than just this one and working with the department on those. There's a couple of places throughout this where it says, and the officers shall comply with state or other applicable law. And I don't know if it's a stylistic choice or if it's just unique to this to not say what that law is. But I think it would be helpful for folks who are, you know, reviewing these to have either a direct reference to whatever the law is, or to say what it is actually, what the parameters are for behavior there. So that was just a question, I think, for Shelby, but also as people are going through and looking at this with a greater level of specificity, I think it would be helpful for the officers as well as the public to know what the law is.
So we generally don't list every single specific law just because it's not always possible to know every specific law to which it applies. The concern would be if we leave something out somebody could draw the inference that it doesn't apply as opposed to being specific as examples. Obviously, public records law applies. That's the main one. And policies regarding law enforcement activities, but generally by practice, we don't list every specific statute. The other concern is that when statutes change or are amended, that leaves our policy out of date. And we have concerns we've had several examples of statutes being updated. Our code or policies aren't up to date. And then that conflict creates challenges when we're trying to interpret which one prevails.
Sure. And, you know, I'm specifically looking at 449.5.3 with respect to juveniles. You know, and perhaps what I'm missing there is examples. And so I don't know if there's administrative regulations that address these or that are interpretive statements that address these. I know that when we're drafting, and you know, the law is a constantly moving target, right? And so when we're drafting, we'll usually put in language saying, you know, this law or its successor, you know, as amended. So, you know, I think it would be helpful, particularly in an area that has, you know, there's a lot of confusion about what the use of these are and how records are maintained and what the process looks like. And so I think some clarity around that would be helpful when I'm reading through this. So that's just my thought.
Yeah, thank you, Valerie. And Jimmy, I see your hand.
Okay. I concur with what Valerie is saying. You know, I think being able to show where appropriate, or at least in some measure of an appendix to the policy, those elements that are tied specifically to state statutes, I think that would go a long ways to, for those folks who want to do a deeper dive into the legislation, into the language of the legislation. I think that will certainly be an appropriate thing to do. I want to note that as a result of this particular discussion, the need for a subcommittee that can take a deeper dive and review the policy for the very things that were pointed out by Jeff relative to a part of the policy that was applicable to the older policy, but has remained in the current policy, and I think that validates the use of other eyes to review the policy as well. And again, this is not a any type of value judgment on the part of the work that has been done by the department and Shelby and others. It simply says one of the roles that this board can play is to utilize its shared experiences, its professional and life experiences to ask those questions. Does this particular section of the policy make sense? Is it consistent? You know, most of us have probably been engaged in wordsmithing before. I know I have spent much time with it. I'm sure Valerie has spent lots of time, as well as Justin. We want to make sure that the language we use is easily understandable by the officers and as well as the public. And so I want to really push, in a gentle way, the establishment of some type of group that could continue to look at this as we go forward, because this is really an important part of the work that we do.
Yes, agree and hear you loud and clear. Like I said, we just need to work out the best method or strategy for some sort of work session or work group or subcommittee. And we'll get back to you with either options or a path forward.
Is it possible to see a show of hands who would be interested in being part of the subcommittee?
I see 4 hands. Yeah, I see 4. Okay, thank you. And if we have options or need your input, we'll let you know. Thank you. Let's see, and John, I think that wraps up our discussion on body cams, and we can move on to the next portion of our agenda.
Great, thank you very much for the great questions and the suggestion. Our next section is really in terms of just opening up the discussion of current event, giving the opportunity for the board to really create some space to talk about any events that you know of that may have an impact on the Tigard community. So I'm just going to open up to the board to raise your hand and maybe share with us in terms of any events that you may know of.
Jimmy, I see your hand.
This is just in response, I think, to an email that came out, but I'm not exactly sure. Was our involvement in connecting with community activities. I think there was some early discussion last week about going to the farmers market and having, I guess, a booth or something. And who initiates that? Is that something that the staff will set up and then allow us to go? I can come sit for a half an hour. I can come sit for 45 minutes.
Eduardo can answer that.
Yes, I sure can. Jimmy, I sent out an invitation to the board to sign up. So far, I believe board member Lafgren has signed up for a shift, so I'm looking forward to that. They are in installments of about 3 hours a shift, I think. And so it's an opportunity to join the rest of the citywide effort in connecting with community at the farmers market. And I can resend the link for you
and
or to all of you.
I believe that we sit at the City of Tigard table. We don't need our own table. Is that correct? We join the City of Tigard table that's already there at the farmers market, right?
Yes, that's correct.
Okay.
Yep. You would be joining the citywide effort. And of course, talking specifically about the Public Safety Advisory Board. Right. Looks like Board Member Newton has something to add here.
Yeah, I just wanted to say it's really easy to sign up. I'm already signed up for 3 shifts, so really easy.
If Eduardo, if you could resend that link just in case so that my old memory can find it. Because I'd be more than happy to jump out there and put some suntan lotion on if it's sunny and and do a shift.
It's in the shade, Jimmy. It's all in the shade. It's all under the bridge. You're fine.
Oh, okay. All right.
Yes, and you would be joining someone from the city manager's office. We're spearheading that effort.
And Justin, I see your hand.
I remember, I think a few months back now, when there was a rise beginning in anti-Asian hate crimes across the nation, that I spoke on that. And I wanted to bring something to our groups and also the community's attention regarding how, unfortunately, there are still attacks that have been happening very recently over on the east side of Portland, and specifically around the Jade District in regards to people being approached in their cars by large groups of folks to intimidate and try to attempt to steal items from them. Actually had a very close extended family member be mugged of their purse while they're out in Clackamas. And I want to bring note to that still happening within our greater Portland area. But one of the things that I also do want to note, for better or for worse, those community members from East Portland have mentioned that they have been coming out to Tigard actually to do some of their shopping either at Costco or at H Mart. And one of the reasons is because they cited that they feel safe here. And so in light of how terrible that is, that they do not feel safe in their own communities, I do want to highlight and commend the environment that we have here, where they feel safe and comfortable to be out in our community and to shop and to engage out here. And so I wanted to make note of that.
Thank you for sharing that, Justin. And John, I see your hand.
Yes, thank you, Justin, for sharing that. It was a past event, so I just want to mention in terms of last Saturday was the NAMI Walk, which is the National Alliance on Mental Illness. It was downtown Portland, just really in terms of recognition of the work that NAMI does, which is advocating education and support for people with mental health challenges. May is the month of mental health, and so it's really in terms of just opening up the awareness. And we're going to have more discussion as this board look at in terms of behavioral health and mental health challenges and how it intersects with law enforcement. So again, just wanted to just shout out for the month of May of being mental health awareness.
Thanks, John. Oh, and Jimmy, I see your hand.
Okay, and this is in relation to what Justin has been speaking about, but it's actually a question for Liz. Liz, and I may have missed it in, the many things that we've all been doing lately, but has City Council passed any resolution relating to the challenges, the violence that has been directed at our Asian brothers and sisters in Pacific Islanders?
I believe we did talk about it, and I'm trying to recall the exact action that we took, but I can get that to the group. We have talked about it, very concerned, and so yeah, I can get that to you. I was thinking about that when Justin was talking, just horrified about the experiences that people are having, and I'm grateful that people are feeling safe here, but it's something that is on our minds, and so I will get that to the group. So
I think that would be wonderful, and certainly if council hasn't approved the resolution, I would hope that would be something that they could do. It's certainly, we have members across the region. We live in a region. We don't live on the island of Tigard. Yeah. We live in, Washington and parts of Multnomah County, and people travel. And as I want my Black brothers and sisters to be safe coming out to Tigard. I want my Asian and Pacific Islander family to do the same. And so words mean something. Yes. Words mean lots. So, that would certainly be something that perhaps, you could spearhead if the council hasn't, then.
Yeah. I absolutely will. I was thinking about, I will contact our assistant tomorrow and follow up on that. So thank you for bringing that up, and I will do it. Thank you. It's really important.
Thank you, Jimmy. Thank you, Liz, for following up. John, I don't see any other hands, so I think you can wrap up our meeting.
Sure. But just tonight feels great because it really support what we're here for, to develop an understanding of the public safety structure. We talk about policy and procedure of the body-worn camera. We continue to talk about and trying to eliminate institutional racism within Tigard Public Institution by centering equity and racial justice. So it's great to have those discussions, and really it's great to have you all with your background, with your experience, and really committed to the city. So thank you. With that, I just ask the board to motion to adjourn.
So moved.
Oh, before I know you motioned, but I just want to give Kim an opportunity to give us next steps.
Next steps are, I know we'll be reviewing steps forward for reviewing the body cam policy, and we'll be meeting again in 2 weeks.
Thank you, Kim. So Valerie, thank you for motion, and one a second.
Second.
Thank you, Jamie. Are there any objection? So move. Have a good night, everybody, and thank you.